Welcome back to this channel, ladies and gentlemen. To the returning subscribers, karibuni tena, and to the new viewers, or if you have just stumbled upon this video in YouTube, kindly consider subscribing, like, share, comment down below your thoughts about this channel and what you'd like us to touch on next. So this one is a continuation of a series that we began on what we call vaginitis, which we defined in the video that came before this. So there is the link that I'll put in the description box down below so that you understand this particular series that we are undertaking. But just as a recap, we are tackling what we call vaginitis, which we had defined previously, that it is any condition that results in vaginal discharge, itchiness, irritation, or rather burning. So we had classified them that there are two wide causes of vaginitis, which could be infectious causes, which account for 90% of the cases, and non-infectious causes that account for 10% of all the causes. So we were majorly dealing with the infectious causes, which in the previous video we talked about bacterial vaginosis. So in this particular segment, we're going to talk about what we call vulvovaginal candidiasis, which falls under the infectious causes of vaginitis. So just as the name suggests, vulvovaginal candidiasis is fungal infection of the vagina, and it is caused by a fungus which we call Candida albicans. So how can somebody develop the risk factors to acquire this Candida albicans and develop vulvovaginal candidiasis? One of the major risk factors includes, first and foremost, pregnancy, because as you know, during pregnancy, a lot changes in the body. There's change in immunity, there's change in the normal environment within the vagina, and all this combined could predispose somebody to developing this candidiasis. The second risk factor is antibiotics. So if you take quite a lot of antibiotics endlessly without any indication, especially penicillin and fluoroquinolones, these ones could end up killing the normal flora within the vagina. So if the normal flora within the vagina is killed, it gives room for the rise of this Candida albicans. So it is not advised that you just be taking antibiotic without any proper indication. So that is why we normally say that is a term that is called rational use of antibiotics, because if you won't use the antibiotic correctly, it could cause this vulvovaginal candidiasis by killing the normal flora in the vagina and thus causing an imbalance. And now the third and most common cause, also rather not common, the third risk factor is immunosuppression or low immunity or weakened immunity. Doesn't matter how you call it, but the end result is that the immune is weak. So there are some conditions that happen in the body that causes the immunity of a person to be weak. Some of these conditions include diabetic, cancer, and HIV infections. So if you have any of these conditions, it means that your immunity is weak. So if your immunity is weak, you end up getting this vaginal candidiasis. And remember, this vaginal candidiasis is a fungal infection. It is also important to note that it is normally almost always common for fungal infection to attack people. So if you could be having recurrent fungal infections, it could be a sign of immunosuppression or rather weak immunity. So that is why low immunity or rather weakened immunity falls in this category of risk factors. Now, we now know the risk factors, these things that if occur in the body could make you acquire this particular condition. So what are the signs and symptoms? So vulvovaginal candidiasis presents itself in an array of ways. So some of the symptoms, and the main one that is very difficult to miss, is a whitish vaginal discharge that resembles curdled milk or maziwa mala. So that is the first thing that somebody will notice. You'll realize that you have a discharge, but he discharged in a kama maziwa mala, or rather curdled milk. Another thing is that you could be having painful urination or rather dysuria. The third symptom could be painful sexual intercourse or dyspareunia. So whenever you're having intercourse with your partner, you will be feeling some sort of pain. So that one is also another key feature to look out for in order to rule out the presence of this vulvovaginal candidiasis. So when you look at the vagina itself, if you are in a position to examine yourself back at home, or if it is the clinical officer or rather the doctor who is examining you, they could be seeing some sort of lesions, which we refer to them as satellite lesions. So those are things that you need to look out for. So we have said whitish discharge that resembles curdled milk, dyspareunia or rather painful sexual intercourse, dysuria or rather painful urination, vaginal itching or rather burning sensation could also be present in this particular case. So if you have any of those symptoms, kindly get checked. It could be vulvovaginal candidiasis. So we've seen the symptoms, we've seen where it comes from, and we've seen everything that could bring it forth. So how do we treat it? So this is a fungal infection, so majorly we use antifungal medications. So in pregnant women, because we say that pregnancy is one of the risk factors, most of these antifungal medications are never safe in pregnancy. So if a pregnant woman presents in the hospital, rather even you at home, you have such symptoms and you're pregnant, it is not indicated that you take antifungals orally. You can use what we call pessaries, or rather antifungal medications that are used to insert inside the vagina, and that could be clotrimazole pessary. So for people who are non-pregnant, you could use oral antifungals. The most common one that we normally use for this case is what we call fluconazole. You could get the 150 milligrams tablets or the 200 milligrams tablets, depend on the setup and the availability of the medications. So you could use those ones or you could insert. Now, it is also important to note that these fungal infections, vulvovaginal candidiasis not being left out, could be very notorious. You may realize that somebody has the infection today, gets treated, 2 weeks later the infection recurs again, a month later the infection recurs again. So it is important that when you have this infection more than 6 times within a given period of time, that this infection is actually recurring mostly. It is important that you get checked for any potential condition that could lead to immunosuppression. That could be HIV or diabetes or any form of tumor that could arise. However, in some cases, you may realize that somebody could just be having the recurrence of this infection, yet they don't know where it is coming from. So it is important that you get checked these conditions and also ensure that your genital hygiene is at top notch. In the event that this infection tends to recur mostly, there's a drug that is called fluconazole. So I want you to try this. If you have had this condition frequently every now and again, I want you to take fluconazole in this manner. You are going to count day 1, at day 4, at day 7, and each of these days you'll be taking 1 tablet of fluconazole, that is 150 milligrams. So day 1 could be today. So today you count as day 1. Now tomorrow will be day 2, you won't take any fluconazole. Day 3, you won't take any fluconazole. Now day 4, you take another tablet. So after taking another tablet at day 4, day 5, you don't take, you rest at that day. Day 6, you don't take. Now at day 7, you take another tablet. So you'll find that in 7 days, you've taken 3 tablets of fluconazole tablets, 150 milligrams in 7 days. So after this completion of 1 week regimen, as I have explained, now the subsequent weeks, you'll be taking 1 tablet of fluconazole once weekly for the next 6 months. So I want you to try this remedy and see if the condition will improve further, because we have quite a lot of cases that people say that have been having this infection and again and they are not responding. And during this phase, try to avoid antibiotics as much as you can, because we also seen that antibiotics could also lead to these kinds of infections. Now finally, as I finish on this segment, it is important that you continue monitoring the genital hygiene. Make sure that you don't wear what we call damp or tight clothing. Avoid feminine perfumes. Avoid vaginal dodging, as I had said in the previous video. And above all, it is important to note that when you have vulvovaginal candidiasis, it is not mandatory for your sexual partner to be treated. They are the same way as in bacterial vaginosis, as these two conditions are not sexually transmitted. So I think that is enough for now. Kindly digest. If you have any more concern or any question, you can reach out to us in our WhatsApp phone number, which I've given down below. So kindly consider sharing, liking, subscribing for more health talks, and you get to know your diagnosis. Thank you.